The Max Foundation has joined with patient groups and patient associations around the world to proclaim September 22nd as International Chronic Myeloid Leukemia Day. We decided to take this opportunity to speak with Pat Garcia-Gonzalez, the Executive Director of the Max Foundation, on the topic of advocacy within the CML community. Thanks for being here with us, Pat. We look forward to hearing your thoughts.
My pleasure.
Can you start by telling us a little bit about advocacy within CML?
Sure. We have to remember that global advocacy did not exist before the internet came about. So really it was only in the mid-90s when people started having broader access to internet that listservs came about, and people started communicating with each other, you know, really desperately trying to find a donor for a transplant for CML. Back then this was the only hope that a CML patient would have. And so it was incredible to be part of that community, and in the year 2000 see a big transformation when Dr. Drucker started his trials for imatinib, and patients started hearing this and hearing about this miracle drug that was putting CML patients from a blast crisis to really in remission very quickly. And so they started telling each other about the trial. They started giving each other Dr. Drucker's phone number. People were calling Dr. Drucker, flying to Oregon, and signing themselves up for this clinical trial. And so the social media played a really incredible role at that time. Now that was the year 2000 and 2001, and so fast track 10 years later, today the CML community has patient organizations and associations in more than 50 countries. We're all united in the CML Advocates Network, and you know, we are working really hard in issues that are common to all our organizations. So it has been a really very interesting and incredible time for CML advocacy.
It's very powerful to think about the individual patient voice and how much it can be impacting advocacy.
Yes, and I think that CML is obviously a rare disease, but it can teach a lot to other diseases how organized this community is today.
So can you tell us also what you see as the current needs within the CML community and how you see an awareness day making a difference?
Sure. You know, there's a broad range of issues occupying CML advocates and CML patients. On the one hand, we know that imatinib was this great drug that transformed the disease. But today there's not only imatinib, there's many drugs, there's a lot of research on CML, and so one very important role of advocates is to bring that information from researchers to patients very quickly, again using social media. So that's one hand. On the other hand, you know, there is not yet extremely broad access to all these new drugs. We do have to remember that there has been unprecedented access to imatinib in the past 10 years. And that was wonderful, but nowadays the disease has a lot of different treatments available, and so if these are not available in every country, you know, these patients cannot really utilize those treatments. So access, having the CML as a disease recognized by governments, and having those government officials understand the importance of having access to treatment, that's something that occupies a lot of the energy of advocates. Also, we have a situation where in some countries where maybe treatment is available, we are still, after 10 years, not able to diagnose the disease. And that is unacceptable to advocates. And we're working really hard to bring diagnostics to every country. In these countries, sometimes if you're able to get diagnosed, then there's no way to monitor your disease. So diagnostics and monitoring is a very important issue. And last but not least, issues of quality of drugs. We have nowadays many countries where we don't have the enough controls to know what products are coming into the countries. And we have a wide variety of quality. We're having some issues understanding how these drugs are accepted into the country and marketed in the countries, and so that that's an issue that concerns many groups in many countries.
Mm-hmm. So you've outlined for us several different points that we as advocates can take to our local health authorities, national health authorities, and global health authorities, and we have a chance of really improving outcomes for people living with CML.
Yes, that's why at this point we think it's really important the proclamation of CML Awareness Day globally, so that we can use this day to really increase public awareness and government awareness of the needs of CML patients.
And so, looking forward, what do you see as the future for advocacy within the CML community?
Well, for somebody who's, my first experience with CML was 20 years ago, this is actually a very exciting time. For the first time, we are talking about a cure.
Right.
We all want a cure, and as a CML community, that is our goal. We also obviously are very keen to make sure that there's good access to treatments everywhere in the world. Our goal is that you should have access to treatment, care, and support no matter where you live. And that is a human right of every CML patient. And so the community is very united to achieve that. And we see a day where patients will sit together with government, industry, and physicians to draft these access plans for the countries, and we have that already in some countries, so we're very excited. We're very, very excited, and I think that the message today for all patients is to keep going, keep working hard and together, and we want to wish every CML survivor a very happy, peaceful, and healthy CML Awareness Day.
Well, it feels very good to be part of this movement, and it's great to hear your thoughts, and we thank you for everything you do to help within the CML community.
Thank you.